Hello everyone, welcome to Mediverse Atlas. In today's video, we are going to talk about the Myasthenia Gravis. This Myasthenia Gravis is a very important question and it is clinically related to the neuromuscular junction. If you have not watched the video of neuromuscular junction, I'll be providing the link in the description. Please go and check it out, but please make sure that the concepts of neuromuscular junction are clear before studying the Myasthenia Gravis. Now let us talk about Myasthenia Gravis. This Myasthenia Gravis is an autoimmune disorder of neuromuscular junction and it is characterized by weakness, rapid fatigability of voluntary muscles. Now, what is the etiology? It is the autoimmune disease. Basically, what is autoimmune disease? That is our own immune system acts against us, right? So this is the autoimmune disease and presence of IgG antibodies against the nicotinic acetylcholine receptors on the postsynaptic membrane. So IgG antibodies are created against the acetylcholine receptors, the nicotinic acetylcholine receptors which are present on the postsynaptic membrane. Okay, now what is the pathophysiology? As discussed, these antibodies are created. Now what does these antibodies exactly do? They bind to the postsynaptic acetylcholine receptors, leading to decrease in the number of acetylcholine receptors and flatten the postsynaptic folds. When we look at the postsynaptic membrane, it's something like this, right? And it has acetylcholine nicotinic receptors. Now, in myasthenia gravis, what happens is there are antibodies, the IgG antibodies are created against these receptors. So these antibodies, they bind to them and they destroy them and they decrease the number of acetylcholine receptors, and they also affect the postsynaptic membrane. So how do they affect the postsynaptic membrane? The junctional folds are not seen. So postsynaptic membrane, they become flattened like this in the myasthenia gravis patients. Okay, and what is the another important point is they reduce the end plate potential, leading to failure of muscle depolarization, resulting in the muscle weakness. So if end plate potential is not generated, the action potential is not generated. If action potential is not generated, depolarization do not take place. If there is no depolarization, there is no contraction of muscle, leading to the muscle weakness, right? Now what are the exact function of these IgG antibodies? That is the acetylcholine receptor antibodies. So these antibodies are called as anti-acetylcholine receptor antibodies. Now what are the functions of this exactly? So they competitive with acetylcholine to bind with acetylcholine receptors, producing receptor blockade. Okay, and they induce endocytosis of acetylcholine, that is they decrease the number of acetylcholine receptors and they damage the postsynaptic membrane, that is the membrane becomes flattened, that the junctional folds are not seen. Now, what are the changes at the neuromuscular junction? Try to include this thing in your answer sheet so that the examiner feels that you know the concept. So, first, there will be decrease in the acetylcholine receptors and flattened or destroyed subneural clefts. There is reduced end plate potential and there is defective in transmission of action potential. So, this is nothing but the summary of the whole pathophysiology. Now, what are the features? Fatigue is seen. Now, how does this fatigue is caused? So this fatigue is caused due to the postsynaptic changes along with presynaptic rundown. What is this presynaptic rundown? That is decreased acetylcholine on repeated stimulation, and end plate potential falls below the threshold, leading to the muscle fatigue. So what is the main important point to note in this fatigue is, see, understand the concept. So there is something called as presynaptic membrane, right? There is synaptic cleft and there is postsynaptic membrane. What exactly happens is this, what do we say, there is decrease in the number of acetylcholine receptors, right? So this acetylcholine is synthesized from here, it is released from here, but acetylcholine cannot bind to these things, okay, to the receptors. Why? Because there are decreased number of receptors and there are no junctional folds. Due to this, there is reduced end plate potential and there is no action potential, leading to fatigue. Now again, women are more affected than men in the 3:2 ratio, and muscle weakness increases with activity and improves with rest. So patients feel better in the morning, but symptoms are aggravated in the evening or are aggravated after the exertion. Now, this is the important point in the question. If in the question there is a symptom of aggravation in the evening or aggravation of symptoms after exertion, go it for myasthenia gravis. Okay. Next, what are the most commonly affected muscles? Extraocular muscles are mostly affected, and due to the the pathology of the extraocular muscles, there will be ptosis, diplopia, and drooping of eyelids, and these are the earliest symptoms of myasthenia gravis. You can see this is the ptosis, which causes the drooping of eyelids, and facial muscles are affected, and bulbar muscles are also affected, which causes difficulty in chewing, swallowing, and speaking. And proximal limb muscles are mostly common affected. Okay, in severe cases it may cause paralysis of respiratory muscles leading to death. Now, what is the treatment of this myasthenia gravis? One is administration of the acetylcholinesterase inhibitors. So what are the acetylcholinesterase inhibitors? They are pyridostigmine and neostigmine. So these are the acetylcholinesterase inhibitors. These drugs, they inhibit the acetylcholinesterase, which increases the concentration of acetylcholine at neuromuscular junction, creating an end plate potential, leading to creation of action potential, which causes the muscle contraction. Okay, and immunosuppressant therapy also can be given. What drugs can be given? Like glucocorticoids and azathoprine is given. Like steroids are given basically in the immunosuppressant therapy, and thymectomy can be done. And that is plasmapheresis can also be done in severe cases. What is this plasmapheresis? It removes the acetylcholine receptor antibodies from plasma. So this is all about myasthenia gravis. If you have any doubts, please do comment in the comment section, and do follow us on Instagram. You can directly DM us your doubts in the Instagram, and please do follow the Telegram channel, and like, share, subscribe, and comment. Thank you.